Okay, thank you. Okay, good afternoon, everybody. My name is Dr. Beverly Gore, and I am a co-founder of the Asian American Health Coalition, and it subsequently has established the Hope Clinic, which we're very proud to be in 4 different locations now, and recently opened the new facility out on Bel Air and Metro, way out far in Alief. So we want to welcome you all here. We're hoping to start having regularly quarterly meetings. It may be online, it may be hybrid. We are just happy to start these again. I'm going to go ahead and introduce our first speaker because he has limited time. But our first speaker is going to be State Representative John Rosenthal. And just a little of his bio, he has been in Texas since 1979. And his father was the John T. Stewart III, Centennial Professor of Mathematics at the University of Texas at Austin for over 25 years. And his mother is a retired cosmetic states sales director. He is a graduate of UT Austin. And one of the things I thought was real interesting about him is the only one of 2 practicing engineers in the Texas State House of Representatives and the only mechanical engineer serving in the body. State Representative Rosenthal serves, I think it's really nice, he says on his bio, he's grateful and fortunate enough to be elected by the great constituents of 135, which is Northwest Houston, Cypress, and Jersey Village. So I'd like to go ahead and give the floor to him. He's going to talk about a bill that he introduced called House Bill 986. Okay, so I'll just let you take it away, John.
Well, thank you so much. And thanks for inviting me to join you today. And really, thanks for making this accommodation. I really appreciate that. So I'm here to talk about my House Bill 986, which was designed to promote inclusive demographics. This is a bill that, especially for healthcare purposes and stuff, demographic information is collected by state agencies from individuals, especially those receiving state health benefits like Medicaid. And the way that it's collected now is not very granular at all. I mean, you've all checked the type of forms that we all fill out when we do these things, and it asks you to identify maybe your ethnicity or your origin, something like that. And this bill would allow for much more granular data to be collected. And the reason I brought that is because like Asian American, Pacific Islander, like if you check this box, for example, that applies to anybody who's East Asian, Southeast Asian. I mean, there's a whole range of subgenres in there. And so we're not collecting this data. And I and the advocacy groups that came to present this bill and asked me to carry it, you know, the whole purpose of this is, for example, if you identify as Asian, you know, this bill would create subcategories like Burmese, Cambodian, Chinese, Taiwanese, you know, Korean, Vietnamese, Iranian. It's like these groups, especially when we're talking about health data, like this aggregated health data, these groups have different issues. And if you want to be able to address those efficiently and identify things that are happening in these communities, I don't think that we're gathering enough data to do that. So that was the purpose of the bill. Unfortunately, I could not get a committee hearing on the bill, and sadly, I believe that that's driven more by politics than by policy. As an engineer who has a lifetime of experience making stuff actually work in the real world, it still bothers me that the way that things are so political in your Texas state government, but they are. So very few bills in the areas of diversity, equity, inclusion were heard. There are broader, large-scale attacks undermining efforts in these areas. And also there, to just be plain about it, I'm a Democrat, and Democrat bills were summarily, well, let's just say it was much more difficult for us to pass bills in this session than in previous sessions. So I know that we're going to have a little bit of conversation about this, and I don't want to go on and on and on about it, but that's sort of the brass tacks. I mean, I'm totally down for bringing this again. And the more that we work on it and chip away at the resistance, the more likely it is that we can get heard and maybe even have this adopted, where health agencies and stuff are collecting much more granular data on ethnic groups.
Thank you very much for that summary. And we can send out to the participants the links to those bills. We thought about putting them on screen, but it's a lot to read at one time. But Chow will help us get those things to you. I wanted to ask you, you said a little bit about this, John, but what kind of really motivated you, or who motivated you to introduce this legislation? I don't mean to characterize it, but you're a Caucasian male from an area that's been traditionally kind of conservative. So I'm very surprised.
Well, so it is. While it's true that I'm, I tick those boxes: straight, white, Caucasian male, older, and definitely like educated, privileged, all those things. The area that I do, the district that I represent, is actually very diverse, and it's a coalition district. So it's like mid 40% Latino. It's got a high propensity of Asian and South Asian folks, especially in the newer part of this district, South and Southeast Asian ethnicities. And the bill was brought to me by constituents and advocacy groups. And one of our other guests today, had some to do with it. Stephen was a great advocate for doing this, and I was totally on board. So it matches the demography of my district, and also, being an engineer, I'm very data driven, and so I'm a natural person to carry this bill.
Thank you. What were there other legislators who were supportive of it, and why?
Well, Penny Shaw, so Representative Penny Morales Shaw, was very supportive and signed onto the bill, and she's really been an advocate and a champion for inclusivity in many areas. And so, and we're neighbors now with the new drawing of the districts. Penny and Hubert Vo and I share borders with Penny on the north and Hubert on the south.
Oh, okay, that's great. And you mentioned a little bit about what you call it, the politicization. I'm sorry, having a hard time saying.
It's a hard word to say.
Yeah. Were there specific barriers to the legislation being supported any particular groups?
Not so. The bill is not opposed by particular groups. So a lot of the bills that I bring, will have folks that advocate both for and against for different reasons, on different subjects. On this one, the bill was not opposed on its content that I'm aware of. So it's not like I had advocacy groups in my office like I do for some of the other legislation that I may forward, either supporting or against. There were some folks supporting, of course, but I didn't have anyone lined up against this bill, let's say philosophically or on policy terms. And sadly, while politicization is a difficult word to say, it's much more difficult word to live with in these times where it gets in the way of forwarding good policy.
Yes, for sure. And the other thing I had is, and you do want to try to introduce the bill again on the next legislative session. What might you do to improve the chances? Will you modify what's your game plan?
Well, that's a good question. So while we're always looking to improve and absolutely plan to bring this back in the next session if I'm fortunate enough to be reelected. So we'll definitely take input from others. But again, it was not on the substance of the bill. It had more to do with politics in the House. And so the way to chip away at that is to go after the source of that resistance, try to bring some more people on board, try to build a coalition across the aisle, which I have been able to do on many other bills. And so I would enlist some of my neighbors, some of my more conservative leaning neighbors to get in on this. I don't know, the Mike Schofield in District 130, it shares a long border with me on the west side. And on the north of 290 for me is Dr. Tom Oliverson. And so I'm happy to talk to the good doctor about the benefits of collecting more aggregated, more granular data. And, by building a coalition and then encouraging folks who are on this call to contact the committee members and the chair of the committee next time, whenever this is filed and assigned to a committee. A great way to advocate is call the office of the committee itself, the chairperson, whoever that may be, even the committee members, to try to build some momentum for it. Those are all things that we can do to try to move it forward in the next session.
One of the things that has occurred to me is we've got to have certain compelling arguments for why a piece of legislation is important. Can you give us any suggestions about this? Because honestly, a lot of people feel like collecting such disaggregated data is expensive and an unnecessary expense. So tell us the counter argument for that.
Well, first, I don't think it's that expensive. All it is it's setting up forms. So, and a lot of times we fill out these forms online and stuff, or we go print them out and then fill them out. Collecting this more granular data is not a heavy lift. It's not like it's going to cost a lot of money. And I don't know that we had a budget analysis on this one, but if there was any, I doubt there was any impact to the state, although if there was, it should be pretty small. It's a tiny little bit of programming. It doesn't take extra employees or anything like that. And really, I would guard against that argument about it being expensive, because with the information that you're gaining, if you're able to make decisions and make moves that benefit people in the public health sector, not only is it good for the humans that you're helping, but this, there you folks in the medical and healthcare communities, that anytime you can keep people out of the hospital or address their health issues up front, it saves a lot of money all the way around. So we're talking about insurance money and hospital money and all that sort of thing. And so I think if we do it, it's an investment in people's health, and it should be revenue neutral for the state overall. I mean, I would think.
That sounds good. I appreciate you telling us that. I'd like to open the floor because State Representative Rosenthal needs to leave about 4:30. Does anybody else from the floor have any questions for him?
I do. I'm trying to pull up the bill right now and my internet's very, very low. Did you specify any version, like the ISO versions that are available for race and ethnicity?
So the bill has a list, under each ethnicity. It's got sublists to sort of spell out a bunch of those. And then in the bill, it just says, you can write in others if there's others to write in. But right. I'll be honest, I don't actually know the source of those lists.
Yeah, it's an international standards organization, and I'm with Hope Clinic, and so one of the so we have to use a standardized set, and actually all healthcare facilities have to use a standardized set if they are on a accredited or certified EHR. And so like I have an issue with the one that our EHR has picked, because they have picked the one where Chinese is a race as opposed to an ethnicity. Vietnamese is a race. It gets real granular. On the other side, Cuban is an ethnicity, Puerto Rican is an ethnicity. So there's not a whole lot of rhyme and reason with it. So I like the way you did it. Thank you.
Stephen, did you have a comment you want to make?
Yeah, I think from my memory, there was a section that said that those populations, those ethnicities were chosen based upon the population size. And then I think the categories would get updated based upon the most recent American Community Survey reports. So there was like a threshold number. And yeah, that's what influenced or informed those certain groups to be included.
Okay. Any other questions from our participants? Did we lose John? Is he still there?
I don't see John anymore. I think he got kicked out for some reasons.
He probably had to leave. Yeah. Okay. If y'all have other questions for him, just write them in the chat, and me and Chow will get those to him, and I'm sure he can respond to those. But we appreciate him being on the line with us for as long as he could. He had something that had a hard stop it.
Bab, he's back.
Oh, he's back. Okay. Okay.
Yeah, there we go. So sorry about that. I lost
okay.
connection, and it's really weird. I got a message on my phone saying that my phone is overheating, but I'm not hot, so it's okay.
Oh no! Actually, okay, he overheats. Anybody else have questions for State Representative Rosenthal? Because I think we may let you go ahead and go. While you were gone, I told the audience that if they had other questions for you, write them in the chat, and Chow, who's facilitating our discussion, we'll make sure we get them to you and you can respond to them. Okay.
Okay, yeah, and I'm happy to respond. Folks can reach out to my office. I am having a town hall on, actually it's tomorrow evening at the Richard and Meg Weekly Center. So we'll be there from 6 to 7:30 tomorrow evening if anyone wants to come talk about any of these things.
Oh, wonderful, wonderful. Thank you for letting us know. Okay, well, we'll go ahead and dismiss you for right now, John, and thank you so much for your time and for getting some, I know you're very, very busy, and we appreciate it very much, okay?
Thank you so much for having me on today, and
we'll
hopefully we'll see each other soon.
Yes, thank you, thank you.
Thanks.
We'll go on, Chow. Let's see. I think I'm going to be up next. Okay, so again, for those of you who are just joining us, my name is Beverly Gore, and I am a co-founder of the Asian American Health Coalition, along with my colleagues Rogine G. Calvert and Lynn Nguyen, and unfortunately the late Karen So. So we wanted to discuss today this topic of AAPIs, overlooked no longer, and updates on data disaggregation and racial health inequities. So I prepared a brief overview. After I finish, hopefully we'll have Representative Hubert Vo on the line, and then we're going to go to Stephen Wu, who's done a lot of work in the area of data disaggregation. So we'll continue. So go ahead, next slide, Chow. Okay, so main thing about data disaggregation is that AAPIs or AANHPIs represent both extremes of the socioeconomic spectrum. Aggregated data, which is what we tend to get, that all of the Asians, all of the Pacific Islanders are put into one category, is very misleading. We tend to be a bimodal population. So this slide kind of illustrates on one side the sweat garment factories in the Northeast where a lot of Asian women work, farmers, agricultural workers, and other Asians who maybe have less resources. Whereas on the right side of the screen, you'll see people like, Michelle Wee, Jeremy Lin, and the wife of Mark Zuckerberg, who's Chinese as well. Anybody have her name for me right away? I can't think of it right now. But anyway, how they are extremely wealthy and have all the resources at hand, whereas the ones on the left are more challenged, but all of them are considered Asian American Pacific Islanders. And when you put them all into one bucket, you get the aggregated data, which is, like I say, very misleading. You take a high number, you take a low number, you put them together, you get, Priscilla, thank you. Priscilla Chan, that's her name. Anyway, you'll get an average, which is not accurate at all. So this is one of the reasons why we really want to get disaggregated data. Next slide, Chow. Okay, so this is kind of what I was saying. Asian immigrants, Asian Americans, are often considered to be a model minority in the U.S. due to their generally high economic and educational status and overall lower disease and death rates. But a lot of our national studies that are federally funded, like the BRFSS, if you're familiar with that, the Behavioral Risk Factor Surveillance System, and the National Health and Nutrition Examination Survey, NHANES, tends to combine 29 different Asian American groups into one category, and hence the information presented for this group tends to mask the differences. It does mask the differences between Asians, the different Asian groups, Native Hawaiians, Pacific Islanders subgroups. So again, we're not getting accurate data that portrays the needs of populations. Next slide. Okay, so just a quick little history. We were talking a little bit about categorization and how the federal government has categorized Asians. So long time ago, when censuses were starting to be taken, many Asians were just considered others. There's whites, blacks, and others, and we were in the others. And then they became Orientals, and then they were called Asians. And then about the 1970s, the term Asian American came into play. And then further on the line, the Pacific Islanders said, we're not exactly like Asian Americans. So it became Asian American Pacific Islanders. And then now the term is Asian American, Native Hawaiians, and Pacific Islanders. And this includes a lot of different groups. Next slide. And this shows you a smattering of some of those Asian Pacific Islander subgroups. So under Asians, and Karen was saying this a little bit earlier, there's Chinese, Filipino, Japanese, Asian, Indian, Korean, Vietnamese, Laotian, Thai, Cambodian, Pakistani, Indonesian, and Hmong. So there's all of these different groups, but as we know, they're very different. And even among the Pacific Islanders, we have Polynesian, Chamorros, Native Hawaiians, Marshallese, Samoans, Micronesians, Tongans, Chooks, Guamanians, Melanesians, Fijians, Papuans. Again, a very diverse group, and yet we're all put into one category, which really doesn't tell much when it comes to finding out health needs and social service needs. Next slide. So this is just a schematic, and this is, I think, from the 2020 proposed census gathering. And so I did this presentation, I think in 2018 was the last time I did it. Oh, can you go back? Sorry. But this shows, this is one of the ways they were trying to capture this data. And you have to think about it too. If we do this for Asian American, Native Hawaiian, Pacific Islanders, should we also do it for white people, Black people, Hispanic people? And actually we should. So it's kind of like what State Representative John Rosenthal was saying, we needed more granular data. So this shows, like for white, they said print, for example, German, Irish, English, different groups, Irish and German, just as an example. If you're Black or African American, you put in Nigerian, or what is your country of origin in Africa. If you're Native American, what is the tribe to which you belong? And then on number 7, what is this person's race? This is some other schematics that they were looking at. So The census is trying to get more disaggregated data, and I'll let my colleague Stephen talk more about that later when he has his turn. Next slide. Okay, so I wanted to acknowledge that several of us have really tried to collect disaggregated data, particularly in the way of health and sociology. So many people are familiar with Stephen Kleinberg, who recently relocated and retired from Rice. He did the Houston Area Asian Survey in 1995, 2002, and 2011. And there are plans in the works now with the new director of the Kinder Institute, Dr. Ruth Lopez Turley, to again do this Houston Asian Survey. A little bit different methodology, but still we want to collect data on the growing Asian survey, Asian population. Stephen Linder, when he did his Health of Houston survey in 2010 and 2017, he actually did an oversampling of Vietnamese because he realized the importance of collecting disaggregated data. He collected data and it shows Asian, but he can let you know if you analyze this data, how many were Chinese, Vietnamese, Indian, and so forth. So you have a little bit more specific data. I want to pat myself on the back. I tried when I was in academia. I had the Asian American Health Needs Assessment, which collected data on Chinese and Vietnamese specifically. It was very similar to the behavioral risk factor surveillance system. We did the Filipino Health Needs Assessment. It was a qualitative study, but it did collect data just on the Filipino community. We did a study on perceptions of HPV cervical cancer among Vietnamese, Filipino, and Korean young people. So that was one of the few studies that had been done on local Korean individuals. South Asian Health Needs Assessment was one of my last studies I did when I was at MD Anderson Cancer Center, and it collected data on Asian Indians, 1,500 of them in 4-county area of Harris, Fort Bend, Brazoria, and Galveston counties. The Houston Health Department, we've done several health summits in partnership with the Asian American Health Coalition, and we also created an Asian American Pacific Islander health profile in 2015. And then there's various Asian American health and sociology studies that have been done by these individual researchers. Dr. Marjorie Kagawa-Singer and Chin Liu have done a cancer support study on Vietnamese, Chinese, Japanese women, cancer survivorship. Dr. Liu for the Chinese community. Dr. Christina Miyawaki has been looking at caregiving among the Chinese and Vietnamese. There's been some elder issues. AARP did a study on South Asian, Indian, Pakistani, Bangladeshi, Sri Lankan, women's health. A researcher named Dr. Chandra at MD Anderson. Childhood obesity among the Chinese by Dr. Cassandra. So we're starting to collect data on specific Asian subgroups, which is good, but there's still, we got a long way to go. Next slide. Okay, so I just wanted to, this is a little bit about state of the art. The White House Initiative on Asian American, Native Hawaiians, and Pacific Islanders is advocating for data disaggregation. The National Heart, Lung, and Blood Institute recognizes different disease risk and created culturally relevant materials. I've seen materials that they created for Vietnamese, Filipino, Chinese. The California Health Interview Study, which is their version of the behavioral risk factor surveillance system, does collect ethnic specific data in Spanish, Chinese, Vietnamese, Korean, and Tagalog. So they're trying to specifically create, collect information on those specific ethnic groups. That was when I was talking about the expense. Now, John Rosenthal was talking about collection of data. That's one thing. But then if you find certain issues and you need to convey health education to specific populations, then that's where some expense may occur in the way of translation of materials or certified translators. In Haynes, they started to collect Asian data, but it was not disaggregated. BRFSS, I've already talked about. The Census 2020 did collect AAPIs specific data. And I was working with the Houston Health Department before, and we do collect some ethnic specific data for certain programs, but it's not a consistent pattern. Next slide. Can we advance? Okay. So these are some of the challenges to data disaggregation. increasing numbers of mixed racial and mixed ethnic. Okay. So anyway, more and more to get towards not solely specific ethnic group or racial group. Can you put yourself on mute, please? Okay. Anyway, so this presents a challenge to data disaggregation, but that's where we probably have the open-ended response that people can give. The Asian diaspora, there's acculturation, influence from other countries besides Asian countries. I am an American-born Chinese, which is very different from someone who's an immigrant Chinese or other ethnic group. Support from other racial ethnic groups. And I want to say, like I said, and Stephen can talk more about this, if we are advocating for disaggregated data for Asian Americans, shouldn't there be also disaggregated data for the Hispanic population? Because, there's Mexican Americans and Puerto Ricans and Cubans and El Salvadorans and all these different individuals from different countries of origin. There's perceived racial discrimination by some Asian groups. So they might feel like if I say what I am, there may be some discrimination expressed against me. There's a cost to collect data on small populations. If you want to collect, if you want to have a written survey to collect this data, you do have to translate the survey, bilingual interviewers and time. Some people are very private, particularly immigrant individuals, about even participating in the collection of data, reluctance to divulge information, and mistrust of governmental or healthcare organizations. So even, like I say, when we want to collect data, the populations may actually present some resistance as well. I think this is my last slide. Go ahead, next one. Okay, is Representative Vo on the line?
We're having a little technical difficulty. Why don't you go ahead and continue?
Okay. So go ahead. Yeah. Well, let Stephen talk then, okay?
Sure. Thank you, Beverly, for the intro and for having me on this really, really important call. So I'm going to talk a little bit more about some of the statistics behind why data disaggregation is important and kind of where the landscape has been more recently. So we can go to the next slide. My name is Stephen. I use he, him pronouns. I'm currently the organizing and policy manager for Woody Juntos. We're a Houston-based immigrant rights organization advancing the full safety, agency, and vibrancy of Asians and all immigrants across the states in Texas. And as it relates to this conversation, I was the coalition lead to this group, the Texas Data Quality Coalition, that was fighting for the bills that Rep. Rosenthal was talking about to increase data disaggregation across different ethnicities and also genders. So next slide. We kind of already talked about why data disaggregation is important. Beverly did a fantastic job, but just kind of re-summarizing, we want to break down demographic categories into subpopulations so that we can clearly and accurately understand patterns in our communities. They could be health patterns, they could be education patterns, they could be labor patterns. But we just want to have, as everyone has mentioned, more granular information that are more relevant and applicable to our people.
I hear you.
Did you want me to finish, or did you want Rev Vote to go since he is here now?
Let me ask him. Representative Vo, are you ready to present now? I think you're on mute still. Hello?
Beverly, do you want him to speak now or wait?
I just want to see if he's ready. If he's not, well,
I think he's getting ready. Hubert, you're on mute. Can you get off mute?
Can you hear me now?
Yes. Are you ready to present? Shall we give you a few more minutes?
You want to hear me what I have, the legislation that I have introduced during this session, or what you want to hear? Yes?
Yes, yes. Okay, Stephen, we'll pause you for a minute and then we will have a representative will go ahead and speak. Okay, here we go. Okay, you ready?
Yes, yes.
Let me just do a quick introduction for you. Okay, so State Representative Hubert Vogt proudly represents District 149 in Harris County, which is located in Southwest Houston, encompassing most of Alief and parts of West Houston and Katy. He's been part of the Alief community for over 30 years, and he currently serves on the Alief Super Neighborhood Council. So many of us are familiar with Hubert. We really consider him a friend and an advocate for our community, but he introduced a couple of bills in the Texas legislature that we thought would be relevant to the AAPI population. So Representative Vogt will give you the floor.
Thank you very much. First, I want to apologize to be having technical difficulties. I'm not a tech whiz, so I have problem logging in, and with the help of Ms. Regine Calvert that helped me to be on the link right now. So thank you very much, and good to see everyone. And the first bill is about House Bill 2563, I believe, that you want to this is relating to a study on the disparities in the provision of certain healthcare services to Asian Americans. What this bill does is the Health and Human Services Commission, in collaboration with nonprofit organization, will conduct a study on the disparity in health services provided to Asian American Pacific Islanders in Texas. And the study will focus on various areas, including mental health services, reproductive health care, care related to violence based on sexual orientation or gender identity, gender-based violence, gender-affirming health care, and availability of language interpreters in healthcare settings. The commission will gather information from relevant state agencies and organizations, ensuring patient privacy and analyzing data by ethnicity. And by December 1st of 2024, a report with the study findings and legislative recommendations will be submitted to the legislature. See, the reason I have introduced these bills and more because I can see the other members in the State House, like the African American and the Hispanic members that have introduced legislation for their own communities, and that's why I came up with the idea: why not? We have to address the challenges in the Asian communities and see what we can do in terms. First, want to start it with healthcare and also related with jobs and work and everything else. So I started our last session with those two areas. So do you want me to give you an example of what I have introduced, or you want to ask questions and I will talk about those two bills later.
I tell you what, if you don't mind, Representative Vogt, go ahead and talk about your second bill, 3348 also, and then we'll open the floor to questions, okay?
Okay. What 3348 is about public education. This is about the study by the Texas Education Agency on Asian American and Pacific Islander students enrolled in public school. This bill requires the TEA to conduct a study on Asian American and Pacific Islander students who are enrolled in public school. The study aims to identify the number of students in this group, assess the English language abilities, identify any areas where their needs are not addressed, and determine if schools have enough resources to support them. The agency will gather input from parents, students, teachers, administrators, and support staff. And by December 2024, the agency will submit a report to the legislature with the study results and recommendations for necessary actions. That's one of the bills that I have introduced, and it was referred to public education, and that's where it is right now. So, and you want to hear the other bills I have?
Actually, yeah, you did have some other ones too. Let's stop right here, and I wanted to just ask you. You touched upon this. What motivated you to introduce legislation about Asian American Pacific Islanders, specifically that other ethnic groups, other minority groups are advocating for their communities, and you wanted to say we needed the same thing on Asian Americans, and that's great. Is there any specific group or incident or event that motivated you to really get this thing introduced?
No, because for several sessions, I just work with the Black Caucus and the Hispanic Caucus and support the legislations. And it's time, last session, it was time for me to say, why not do some research in different areas for Asian communities? Everybody say that Asian students are so smart, they don't need help, but it's when we talk about Asians, we have different communities. We have all kind of Asians, and so we need to understand and see how first, to me, education is very important. So we have to look into the areas of education and see if any challenges need to be addressed for Asian students. And the other second priority when it comes to Asian communities is about healthcare. So in my bill, I address those two areas this session for right now, and we'll see for next session what need to be addressed next. So that's where we're at right now.
That sounds good. The other thing I wanted to ask you is, what other legislators were supportive of your legislation and why?
I have people to sign on to the bills also and to support my legislation, because first I reach out to the Black Caucus and also the Hispanic Caucus, and they have the open arms and say 100% will support you. And also I reach out to the Republican in the House also, and see these are the needs of the Asian communities. And I told them that you see Asian doing well in school, it doesn't mean that everyone is doing well. So we have some challenges in terms of education for some kids, and also when it comes to healthcare, because there is a language barriers. So we need some help in that area. That's why I came up with these two bills right here.
Okay. As you know, Rogine and I are co-founders of the Asian American Health Coalition Hope Clinic. Tell us, we know we're not, we can't be the end all and be all, but what are some of the needs that maybe your constituents have talked about that we need greater healthcare services?
Yes, probably next session. Before the next session come up, we'll probably sit down and introduce. Talk to you and Rogine and your team, and with my office staff, and we kind of record everything, and then we go slowly one by one and see what's the most pressing issues in terms of for healthcare and for education, and we will go direct and hit those bullets and introduce those pieces of legislation directly next session, instead of just vaguely introducing these two bills right now.
Did they get any traction? I know you said it went over to the public health group, but any traction there? Yeah.
Yes, it was. There's some tractions, but over on the Senate is with the help of some members on the Senate. but I have to follow up and see where they at, and we'll keep you updated. On the House, I got 100% support from the House members. Not 100%, but I say about 80% support from the House. But
oh, bless
on the
you.
Senate, on the Senate side, I have to see where it's at. So we just go session by session and slowly try just to keep on hitting them and making sure that they are aware of the needs of the Asian communities also. So we always have the reputation of our kids are doing well in school, our kids are so disciplined, and the community is so disciplined, but it's not the reality in most cases.
Yeah, I think before you came on, I spoke a little bit about Asian Americans still being considered the model minority, you know, high education, no crime and everything. That is not really the case. And I think we only see the shining examples, and we often don't see the issues that are in our community. Sometimes it's our own cultural thing. We don't want those to be seen, but on the other hand, they are there and we need to address them. Yeah. So
yeah, and probably next session, before next session, probably I need to sit down and talk with your organization and anybody else and see what we need to slowly introduce them, make sure that through the bills, and make sure those bills will pass both houses, because the reason that's really pushed me to do this is session after session, I see the Hispanic caucus and the Black caucus always push legislation for their communities. I say, why not? That's why I came up with the idea, why not for the Asians? So, and that's why I built the coalition with the Hispanic members and also the Black members, and have them to support these bills. And that's where I started out with this past session right here.
I think Harold Dutton was one of your co-sponsors, wasn't he?
Yes, Harold Dutton, and because he asked me to sponsor or co-sponsor or some of his bills, so I say, Harold, why not? I mean, helping me with these bills right here, and he was glad to do so.
That's good. That's very good. So it sounds like you do want to reintroduce these bills the next session. Will you change them or modify them somehow?
Yes, we kick around. I'm going to come up with legislation that the Hispanic caucus and the Black caucus have already introduced, and see is adaptable for with our community. And we share those ideas, and we go step by step. Probably next session about 5 or 6 bills for the Asian community in different areas. I try to stay focused with education and healthcare, because I think those are the important issues for our community. I could be wrong, but you tell me next time we sit around and we kick around the ideas, okay?
Well, actually, I was going to say, you know, I know you're a businessman, and I think it's very wise to consider, if you don't have good health, if you don't have good education, you tend not to succeed in business as well. So it all kind of comes together. Yeah. Are there questions from our participants on this call for Representative Vo? Anybody?
Well, I guess we have a special session coming up, but the special session we'll be addressing with school finance and see how it's going to lay out, and school finance also, and see if I can have any kind of amendment or anything put in or introduced for the Asian students also. But yes, we'll see. We'll see what the bill is going to be asking for, and then we'll figure out. So and if I need your help, we'll get in touch with the group and give me some ideas. Okay.
That'd be great. Can you stay with us till 5:30? That's when this session.
Sure, of course.
Thank you. Well, I'm going to go ahead and turn the program back over to Stephen Wu, and we'll finish his presentation. Okay.
Okay. Very good. Thank you.
Thank you.
Awesome. Thank you, Representative Vo. I think your presentation gives more context to my slides, which is why I wanted you to go before me. So we can go to the next one, the next slide. Yeah, I just wanted to kind of reiterate the importance. I don't think I have to do much convincing to this group right here about why data disaggregation is important, but maybe some other things that we did not discuss. So number one, I think it helps tremendously with the equitable or just health resource allocation or resource allocation for any issue area. If we fundamentally know where certain communities current concerns are in terms of based on race or ethnicity or gender or even location, we can more accurately pinpoint what resources in terms of funding goes where. As we know, budgets are moral documents for us to prioritize what we care about. And by having strong data disaggregation on these concerns, we'll, in theory, know where to put our money in terms of helping the people who need it the most. The second part is culturally competent services. And I think this is the part where Hope Clinic has done a tremendous job with meeting our diverse communities' needs. But also I see some other folks on this call like Alex, which I really want to uplift. During the pandemic, there was a lot of efforts to make sure that vaccine outreach was done in language, like in Vietnamese, at the places where our people naturally congregate. And same thing with my current organization, my executive director, she did the same thing with the Korean community. If you know, again, where the people are, what issues they have, what languages they speak, you can then pinpoint the intervention, if you will, that you need to help address those concerns. And I think the pandemic really was a moment where the cities and the counties took a step forward in doing that with the COVID vaccine and also COVID testing outreach. They used zip code data based upon income levels and race and, well, macro race data to understand who were the most vulnerable from the pandemic. And then they positioned vaccine sites as well as testing sites closer to those neighborhoods, understanding that transportation was going to be a concern, cost was going to be a concern. And they wanted to, again, meet people where they were. We kind of stopped doing that as the pandemic is now in its newest phase, but it was very encouraging to see that we do have this ability, right, if we put our minds to it, and of course the political will. The last one is identity and agency. Beverly talked about a lot of how large categories mask people's problems. They also mask like people's identity and sense of agency and belonging. As we know, we use AAPI quite often to describe the Asian and Pacific Islander community. Something that I have a lot of comments on is that term, while in theory very inclusive, it also is potentially even masking different subgroups, specifically the Pacific Islander community, where they're never necessarily part of the conversation as much as with the Asian American community. So if we have data disaggregation, I think it would really help with them seeing themselves more often, not just in data, but just in life in general, and then for them to really like take control of their own futures. All right, next slide. Again, I don't think I need to really show much evidence of why we need it, but I'll quickly go through some of the data. This is kind of old and outdated, but we, as a coalition, the Texas Data Quality Coalition, did some light research on why data disaggregation was needed. A lot of it was based upon like the American Community Survey, based upon the work that Beverly has done, based upon national studies too. And the one thing that we found is that this was across the board, not just with health outcomes, but also with things like health insurance coverage and other things that I'll get into. So first, like starting with the Asian community, as you can see, there are wild variances of obtainment to health insurance. This is percentages of not having health insurance. So on average, 17%, which is not that bad. But when you break it down by different populations, it can go as high as 39% in, let's say, the Nepalese community, which we know has been a growing community here in Texas. So the next slide, Beverly also mentioned how it's not just an Asian issue, it's also a Latinx issue. And so we saw very similar kind of trends where on average, the Hispanic population had around like 32% without health insurance, but that rate goes to over the majority for Honduran, Guatemalan, or Salvadorian, which, as we know, are more recent migrants coming from Central America, escaping a lot of really dangerous situations. So it kind of makes sense that they are also ones with the highest rates of uninsured as well. So moving forward to the next slide, the formatting got kind of weird. We also wanted to make sure we were, again, as inclusive as possible with how much, so this was also part of the bill that we were pushing with Rep. Rosenthal to make sure that it wasn't just Asian communities, it wasn't just race and ethnicity that we were disaggregating, but also gender and gender identity. So just some more statistics on how LGBTQIA plus Texans compared to non-LGBTQIA plus Texans have very, very different rates for unemployment, insurance, food security, and poverty. And then the next one kind of talks a little bit about mental health. So a lot of what we're mostly focused on when we talk about health is usually physical health. But of course, as we know, mental health is an extremely important area too, especially as we know in the Asian community, it's something that we don't necessarily talk the most about, but we should. And this one is kind of the intersection of mental health with race, with gender identity. So on the far left, you see that rates of Black youth who are LGBTQIA plus versus all youth that are queer have very similar rates for things like depression, suicide ideation, and then attempted suicide. But then on the right-hand side, you can see that the rates of actually obtaining care with a therapist, with a mental health professional varies quite drastically. And one of the, I think conclusions that we can potentially come out of this is that the models of care that we have now have potentially failed at providing Black queer youth access to appropriate and acceptable mental health services. It could be cost related, it could be culture related, it could be stigma related. In whatever case, we are not meeting the needs of the community here. And then the next slide. Whoops. Oh, here we go. Yes. Some more evidence. This is between different groups within the Black population. So there's Black Americans who are US born or have US ancestry, those who were essentially descendants from those who were slaves, then Afro-Caribbeans, those who were born or have ancestry in the Caribbean, and then more recent African immigrants too. Again, more just evidence that there are very, very different levels of health outcomes, and this one is specifically with heart disease between the three groups. And then the last one talks, going back to the Asian community, heart cancer mortality once it pulls up.
Can you advance it one more time?
One more time. Yeah, there we go. Perfect. So this was done by a national report on Asians and how we have much higher rates of stomach cancer and liver cancer versus the white population. Again, just additional information of why we need to have data disaggregation. So now I'll talk a little bit more about some of the work that we did back in 2021. If we go to the next slide, and actually I think we could jump to 2 slides, one more. Yeah, so I wanted to shout out the team that was part of the coalition that really helped push some of this work. This was a picture in the legislature in 2021. As y'all remember, that was a COVID legislative session, so we all still were wearing masks. But I wanted to shout out all these people on the screen for all the work that made all the things that we did possible. All right, next one. So one thing I really wanted to point out is all the work that both Rep. Rosenthal and Rep. Vo have done. There was also an equal amount of energy on the external side, where there were community conversations or teach-ins to educate people about the issue. And the way that we were able to do that as a coalition was through community partnerships. So as I mentioned, we weren't only focused on just the Asian population, but also all marginalized groups. And for that to happen, we had to make sure that we made very intentional partnerships. And some groups here, including Hope Clinic, we partnered to have 3 education sessions that talked more about the specific needs for our communities as it relates to data disaggregation. Next slide. We also had some energy in terms of digital and traditional media. We had a pretty strong presence on Twitter and Facebook. We had a newsletter where we sent out alerts. And then we even wrote an op-ed where our communications director shared a little bit more about their South Asian upbringing and families and as it relates to things like breast cancer and why we need data disaggregation for Texas. Next slide. I mentioned those teach-ins. Here are just the graphics for them. We have one with the Black community, one with the immigrant and refugee community, and then one with the LGBTQIA plus community. If we had more bandwidth, we of course would have had even more granular versions of this, but we were a little strapped with the time that we had. We were all volunteers at the time. All right, next slide. Calls to actions. I'm going to talk about this later in terms of lessons learned, but we found that it was really critical to not only push for the bills that Rep. Rosenthal was pushing in 2021, but also other key bills. So this one, HB 4139, would have reintroduced the Office for Health Equity. If y'all remember, there used to be a state office for studying minority health. It was shut down in 17 because of budget disputes. In 21, we were trying, or 19, I don't remember. But this bill would have basically resuscitated that office with funding. So we were trying to help push for that as well. So again, multifaceted efforts are really important to not only make sure that we are pushing as many good things as possible, but you're also building partnerships and also creating a sense of like, I care about your thing and hopefully you care about my kind of thing too. Next slide. Okay, some challenges. I think Rep. Rosenthal mentioned this, but when we were pushing for, at that time it was HB 1608, the chairs became roadblocks. That bill never got a hearing, sadly. We also never got buy-in from the agencies, which I think is something that we learned is that whenever you work in the state legislature, it's not only important to get buy-in from the legislators themselves, but also the agencies that would have to actually implement or execute this kind of policy. If you have them on your side, huge ally. If you don't have them on your side, really huge impediment. So that's a huge thing that we learned in 21. There was, at that time, a potential shortfall in the budget. I know this past session we had a huge surplus, but in 21, because of the pandemic, there was concerns about do we even have enough money to fund not just things like that, but extra things like this. Also, the concept of data disaggregation, I think while there was a lot of amazing work done before this coalition was created to educate what the idea was to legislators, it was still relatively new. And so most meetings that we had as a coalition was really just introducing what this topic was and why it was important before we could even make the ask of like doing something about it. And then the last one was, well, this COVID-19 that year, it was just hard meeting people in person. We had a lot of Zoom calls, and Zoom calls are not the same as in-person meetings, to make a point. Next slide. All right, so lessons learned. So I mentioned COVID being a bad thing. It also was a good thing. I think COVID, during that year at least, put public health front and center in everyone's mind. Everyone was really concerned about like wiping down their tables and getting their groceries cleaned, and then like people coughing and wearing masks, which is great. I hope we still have some of those behaviors to this day. And I think that allowed for a political window. One thing that, you know, I appreciated Rep. Rosenthal saying that he cared about is that he's a data person. I also come from like an engineering background, so we really much vibe for that. But also one of his staff members that we made first contact with, that staff member really resonated with this policy, and I think helped really push for this to become a bill. So making sure that, yeah, the political window is open and that you're making really strong connections and making it relatable to the people you're trying to influence. I mentioned holistic advocacy approach. We were not just supporting our bills, but other bills too that were similar, trying to make this like much larger effort. We had, I think, pretty strong, short and to the point effective policy materials so that people were like very quickly understood what we were even talking about. We had a strong team. We had a really good village that were very supportive, because there were many, many long nights where we thought we weren't getting anywhere. And then suddenly a new legislator said they wanted to be a co-sponsor, which was amazing. Managing expectations is huge. This is definitely, I'm not going to use the word marathon anymore. It's like a baton race. Most likely we would have to hand this over to someone else to really finish the job. Savor the wins. That year in 21, Rep. Rosenthal's bill, while it did not get to a hearing, it got 5 co-sponsors, which was huge for the first year for a bill to be introduced, in our opinion. And also all the like external things that we did with education. I mean, now that like more people are cognizant of what data disaggregation is in general. And now this past year, you know, even more bills about data disaggregation was introduced. So this clearly shows like there's an appetite for it. And then remembering why you're doing this, just making sure you're not straying away from the original mission of helping our people at the end of the day. All right, next slide. Yeah, so next, I'm not as involved as I was before with data disaggregation, though we did have some like memos about what to do next. So I mentioned how agencies are groups that you want to build allyship with and not antagonize them. So one thing to do during the interim that we would have done is to, number one, see if we can work with them to bake in their own budget requests data disaggregation policies. They have a thing called the legislative appropriations request process in the interim, where they have hearings with the public and then submit this through the legislative budget board on what they want for the next 2 years, the biennium in the proposal. If you have your policy already funded with that request, you're like off to a fantastic start. So that's something I would recommend to any advocates or legislators, is to make sure that the agencies that are actually implementing the policy have money for it. It's not enough to just pass a bill by itself. You need money to make it happen too. And Rep. Rosenthal already mentioned, it's not that expensive. You just got to make sure that there's something allocated towards it. Starting early in the 89th legislature, I'm pretty sure groups here are going to do that in preparation, build out really strong partnerships. And maybe my organization that I'm with now, Woody Juntos, we care deeply about this kind of work. We might consider also exploring prioritizing data disag as a key issue area. All right, next slide. Okay, so this is the part that I actually really want to talk about, is how data disaggregation is the fight for it also intersects with a lot of really other cool issues. And I put with Woody Juntos because I'm going to brag a little bit about my organization. So this past session, we fought a lot about language access, also in Health and Human Service Commission, to make sure that all of our communities could even understand the forms to apply for benefits and then to actually secure it. So as we know, if we have better data disaggregation, we'll know the specific languages that our communities speak, the rates of limited English proficiency there are, and then, of course, where they live. And we can, again, pinpoint interventions or solutions. The second thing is immigrant rights. We, as I mentioned, care deeply about the Asian and all immigrant communities. I think there is still some misconception or narratives about how Asians fit within the immigrant rights space. As an example, many of our community members are undocumented, like 1 in 7 Asians are undocumented. We have a large undocumented population of Asians in the state of Texas. And we as an organization have been trying to make sure that we elevate those community members as also being part of this fight. Another thing that we are trying to fight for, which I think would benefit from data disaggregation, is that we have a lot of people who are under real threats of deportation and detention, people with criminal records who made a mistake in the past, but because of that, and because they're not citizens, are under real threat of removal. And we've been helping them trying to find like legal representation, but also advocacy with congressional members. Again, when we think about immigrant rights, we normally think about certain populations. We just want to make sure that Asians are also included in this conversation too. And the last thing is public safety, which might be a little dramatic, but one thing that we care about is going back to the equitable resource allocation, is making sure that dollars go to places that help make us feel safe, like really safe and actually safe. And one thing that we are trying to explore is we worked with the Texas Center for Justice and Equity and Texas Appleseed to understand the most common arrests for Asians in Harris County, and trying to see if there are trends and patterns, and if there are room to potentially decriminalize some activities, because in our opinion, we feel like things like prisons and surveillance and policing hurt our Asian communities. And if we invest more of those dollars towards things like social and health services, then we would actually decrease crimes and criminal patterns. So one thing we found as a top issue for Asian Americans in Harris County was prostitution or sex work. And this is, I know, been a debate in the legislature, and it's potentially something that we might explore trying to help tackle, because as we know, some people are potentially coerced into the industry. And anyways, that's another thing that we think data disaggregation could really help with. And then next slide. Right, last thing for me. I wanted to uplift AAPI data, which I know we wanted to have as a panelist, but they created this wonderful database, which is also not complete, of current policies as it relates to our communities that have been introduced or passed, and they relate towards like data disaggregation, language access, and ethnic studies. And I'll put a link in the chat here. But you can look at every state that has introduced or passed these kind of bills, how far they've gone in the legislative process. And you can also give them feedback that they're missing some in Texas specifically. But again, kind of reinforcing that more and more cities and states are thinking about data disaggregation. I think we're probably at a really strong point about people even caring about this issue. And it's all thanks to the amazing advocates that are on this call, not on the call, and our champions in the legislature like Rep. Bo and Rep. Rosenthal. And I think as we continue doing this, we'll get there one day, hopefully sooner than later.
Thank you so much, Stephen. And I'm glad you did. I kind of had some personal issues going on, and I was going to put that AAPI data website in there. It is a really good resource. It's out of University of California at Riverside, I think. But Karthik Ramakrishnan is the PI for that project. And I know Rogine Calvert often mentions that if you will subscribe to their website, they have free seminars, webinars about data disaggregation and how to advocate for it and the advantages of it and various aspects of why we need AAPI data. So thank you so much. You know, I think you had some additional slides too, Stephen. Did you want to use those since we have a little bit of time?
They're more like backup. I don't think we necessarily need to go through that. Okay,
that's fine. You know, I want to go back to Representative Vo. I think there was some additional legislation that you introduced too, this about AAPIs, didn't you? Besides those two?
Let me see right here. It's just about study on I have House Bill 3348, which is a study by the Texas TEA on Asian American in public schools. That's done. 3886. Many retirees under 65 who have disability and are enrolled in the Texas Employees Group Benefits Act. This is about retirees and health, HMO, and require health insurance. Let me see the other one. Administration of violation and employment of children. No, these not so much. Those are the only two bills regarding AAPI. The rest,
more general. Yes. Thank you. No, we appreciate you advocating for our community like that. Again, I'm going to open the floor. Are there other questions from individuals who are on this call? Looks like Kara.
We have someone put the question on the chat, Miss Kara.
Okay. It says, thank you for the presentations. I have a question for Stephen. For the agencies you reached out to in order to get support in advance, how do you know the right office or contact person to reach out to?
A very good question. And I don't know if I even have the best answer for this. I think for us, what really helped is once we built relationships with legislators' offices, they knew who was the best person to reach out to in the different departments, because you might have to honestly talk to multiple folks, people who deal with administering, let's say, the programs that you want to change, like Medicaid or CHIP, they're all different, or people who deal more with the policy analysis portion to figure out like what is a cost estimate for your bill. So it could potentially be multiple people, but if you were starting cold, I would probably recommend people directly doing the work of the programs that you're trying to change as a starting point. And I would always encourage you to ask them, like, if you're not the right person, who should I reach out to? And they should be very helpful to navigating you.
Other questions? Well, I'll jump in. I have one other one then. Oh, wait a minute. Let's see. Alex put a comment. Thanks, Stephen. Just wanted to say that the Texas Tribune coverage of your efforts with Wuri Juntos was wonderful and provided a great human element to your advocacy work. Yes, indeed. I was going to say, I know one of the things about this Texas legislature is they are very trying to abolish programs that are DEI. We'll be swimming upstream, you know. Representative Vo, you have any ideas about that? Since it seems like the current Texas leadership is very against any programs that emphasize diversity, equity, and inclusion.
Well, you know, we have during session, there are a lot of bills introduced from different groups, and in the House, every session we have the Hispanic, the African American, and the Anglo. So they all have their own agendas, and they always push for the bills being heard or introduced or passed into law. And Asian community, Representative Wu and myself and Angie Chanburn, you know, we kind of look around and see what we can do for the Asian. And this session right here, before going into this session, I had kind of kicked this idea around with my staff and see what could be done for the Asian communities. Everybody have the mentality of thinking that the Asians are doing well in schools and doing well with healthcare and all that, but in reality, we have some challenges also. So that's how I came up with this legislation, and looking forward to work together with all of you for the upcoming session also, and we'll be well prepared for the next coming session.
Good, thank you. I see in the chat, we had 2 questions from people who registered for this webinar, and it's, well, I'm not exactly sure what they meant, but how can you help local residents? Let me just skip over that to the second question. What role do physicians play? Is there a role for doctors to play in this whole advocacy issue?
I think physicians, if it depends on if they are specialized in certain areas, or they are just family practice or whatever, you know, whatever they can share with us is greatly appreciated, because I know that they see a lot of patients every day, and probably, and they, of course, those the data that they have are private data, I believe. But if in generality, if we can ask for those physicians if they can share some information with us, but in the general sense of what need to be done, or what need to be looked at in the Asian communities, and they might probably have a better idea on how to give us some guidances, and we go from there.
Yeah, and I could quickly add, as a non-physician, I think from an advocacy perspective, y'all's like expertise and title as a doctor who is literally seeing clients during testimony or when speaking with legislators would be a huge value add. If you have time, of course, we know y'all have really busy schedules, but if you can make the time, I think it would make a really strong difference. We've seen like associations with medical professionals do a lot of advocacy work in the state legislature, and they've pulled and pushed the legislative sessions in certain directions because of their strong influence. The other thing I would ask is, because I think we talked a lot about how there are still some concerns with people even filling out forms in the first place. And if they see a new form with like more detailed demographic questions, they're going to be like, why do you need to know all these kind of things? And I think as you're like, as a primary care physician, you can tell them like, this is going to be helpful for us to better allocate like health resources to address your needs, like as a community. That's one example. You might have to tailor the wording with your people, but I think having someone who is a professional explaining why this is important in the hospital settings, in the medical settings, in the clinic settings would be very beneficial to just like changing the culture of doing this kind of stuff from the community's perspective.
I agree. Those are great comments. You know, actually, I hope you don't mind, Karen.
Did Beverly freeze for y'all?
Yeah, it's okay now.
She did. She did. She froze. Oh, let me message her.
Uh-oh. I lost everybody for a second. Okay.
You're back. You're back. You're back.
Okay. Did Karen hear my question, or Shane, you want to take it?
No, we didn't hear your question.
My question was, since Hope Clinic does see quite a few Asians, can the data be used from that to provide some guidance to Representative Vo or other people who want to know about the health needs of Asians in our local area?
I can get started, and then Karen can also join me on that. I think for the most part, our data year after year is constantly shifting, especially to represent the broader greater Houston area, the demographics of the greater Houston area. Unless we specifically concentrate, like our Asian American attaining awareness to really focus on the Asian community, then generally, to me, our health aspect data is a little bit not a good representation of the population, the Houston area population. Good, Karen?
Yeah, I was going to say the other thing to remember, we do disaggregate data tremendously. We have different ways of being able to review where people are. We're actually having an issue because of the way that the feds want us to collect data. And I kind of mentioned that earlier, where they're putting ethnicities as races. And so we're working on coming through and figuring out how to get that. The other thing that you have to remember is that we are a primary care provider. So we can talk about Hispanics, and hypertension and overweight and diabetes, but when it comes to cancer, we don't really have that data per se, because again, we are a primary care clinic and that needs to go to a specialty clinic. So we get information based on race, ethnicity. We also have country of origin, country of birth. We ask them to describe their ethnicity. So we get the data in many, many, many different ways.
Good. Thank you. It gives us a good feel for what's available. Well, our time is up, I know, and I appreciate Stephen and Representative Vo for spending time with us and sharing some very valuable information with us. I think there's much more we need to explore and do in the way of data disaggregation and seeing what Asian American Pacific Islander health information is already available and pulling it all together so that we aren't starting from scratch. But I think this is been a very good conversation, and I want to thank everybody for participating. We will be hopefully having quarterly meetings, either virtual or hybrid or in person in the next few months. And we welcome everybody to continue to join in with us. So if are you waving at me, Shane? You just clapping, okay.
It's a hand clap, it's a hand clap.
Okay, thank you. Okay, so we want to thank you, and we'll also again